So I, as an architect and urban planner, look at the issue of health in cities from the point of view as to whether the design of the environment, the streets, the buildings, the parks, make a difference to the way we feel, both in terms of the air we breathe, but also the state we're in. And I think what we're beginning to see is that some environments are becoming so pressured, so big, or so many people crammed in together, what we call density, that I think more work needs to be done in understanding that relationship between the two. Now, of course, that's very different in different parts of the world, and not everything applies in London applies to Mumbai or Hong Kong, but I think the issues are the same. Well, for me as an architect to come to a conference like this one, which is full of specialists, people who really understand and are doing avant-garde, state-of-the-art research in medical issues. It's very interesting to see that people are doing brain scans of people who are either born or brought up in the city or born and brought up in the countryside, and to actually see that there's a fundamental difference. So that says something interesting to a planner, an architect. I don't necessarily conclude the same things that they do, that cities are bad for you and that countryside is good for you, because as we know, and my colleagues at the panel also share this, it's not that simple. But we are on the beginning of a new way of actually doing integrated, interdisciplinary thinking, which then ultimately may make living in cities more healthy at all levels over time. Well, I'm at the London School of Economics, which is already a place that connects the world of physical design with the world of social science. So we're interested to see whether designing places in one way creates ghettos of exclusion or makes society potentially more integrated. What I learned from this is that there's another dimension, which is the individual's well-being and their brain and their mind can also be affected by that. So it's opening up a triangle of inquiry and possible recommendation even to policy, to governments, which is incredibly interesting.